Do you wonder what people see when you walk away? Our backsides can take many different shapes. Not all of them we like. So what can you do to reshape what you've got going on back there? Well, let's ask Dr. Bill Johnson of Innovations Medical. Dr. Johnson, how are you?
Good morning.
A popular topic of conversation here on GMT with you. We're talking about the backside. So let's talk about the different shapes that you see, because everyone comes in different shapes and sizes.
Yeah, we come in different shapes and sizes, but there's a few that we see with some regularity. Now, this is probably one of the very most common, and we refer to this not particularly creatively as the saggy butt, because you can see she's way down here. And so what we want to do is lift it up. So what we'll do is, on most patients, is do some fat transfer into here, and we can start the animation. And with fat transfer, we can see that we are going to the next one. We can see with the animation that we fill it in.
Fill it in.
There we go. Now try it.
There we go.
So we're going to fill in. So where she was before is here. With it down here was where she was. So we lift and fill in.
And this is all with fat transfer.
This is all with fat transfer. Now, on this particular patient, we can also do what's called a string lift and put some strings that will actually lift it in on patients that don't want a lot of increase in size.
But just kind of that lift.
So we do just a lift, or we do a lift with more filling. And we can do it either way, and it really works nicely. And these patients, quite honestly, can get a lot of years off their backside with doing it this way.
Okay, what else? What other problems can we fix?
Well, this is a real common one, too. And we call this one the flat bottom. And you can see she's just real flat through here, just has very little shape. And if we can start the animation again.
Our audience is really enjoying this, by the way, Dr. Bill. You hear them giggling because they're all identifying themselves on here.
We start the animation, and we can see she was right here. And as we fill that out, now she's out here with a much more pleasant shape. And her bottom also raised somewhat, too. Now, the issue on these folks is this zone right through here that's real flat is the limiting factor, because this skin will only stretch so far when we're doing fat transfer.
Okay.
So you can do a lot with these folks, but sometimes about 1 in 5 of these folks may have to have a second time because of how flat this zone is. Depends on how big they want to be.
Okay.
Okay? So then the third one is what we call the cliff butt, okay? And you can see she's got...
Cliff butt, we've got some of that in the audience. They say they're shaking their head.
They're shaped almost like a cliff. They've got a real flat zone in through here, okay, and a real hump through here. So these folks sometimes benefit from having some liposuction right through here. Now, if we can start it, we can see where before they were out like this. Now we can lipo this through here and make them nice and round and give them a nice shape. Fill in down below, so again, they have a nice shape. This is a combination of fat transfer and liposuction.
Really great innovation. Specials for GMT viewers.
Well, for the rest of November, and it's almost out of time. We've only got about a week left. We're on to 10% off of fat transfer to the buttocks, so now's the time.
I would say you can go over there and sign up some happy audience members right over there for that great 10% off offer. Bill, thanks so much. For more information, log on to innovationsmedical.com or call the Dallas location 214-420-7970. In Fort Worth, you can call 817-744-7901 for a consultation. If you have questions for Dr. Bill Johnson, just email him. Questions@innovationsmedical.com. Go over there, Dr. Johnson. Sign up some patients. They're happy. We're coming right back.